Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Marselinus Junio from K2 English for the paper presentation class. So today I want to present my presentation that is titled Knowledge of Periodontal Disease during the Orthodontic Treatment among Undergraduate Students of Faculty of Medicine and Health Sciences, UMY. And this is my outline for my presentation today. Start from introduction, theoretical framework, research methods, result and knowledge discussion, and conclusion. Introduction, it have tissue around them, namely periodontal tissue, which is useful for maintaining teeth. And in every dental and oral care condition, the health of periodontal tissue is the basis of almost all dental care. Healthy periodontal tissue itself can be seen from the pink color. The texture is like orange peel. The consistency is supple, and the sulcus depth in the gingiva is 1 until 2 mm. Inflammation of the gingiva is followed by a change in the shape of gingiva, which is usually expressed according to color, size, shape, and consistency, and also surface characteristic. It is according to mention and LA 1993. The most common periodontal disease in humans are gingivitis and periodontitis. The disease is an inflammatory response to the periodontal tissue that can cause tissue damage. It is according to Carranza in 2002. WHO stated that the periodontal disease is a serious health problem and is common in developing countries. One of the dental aesthetic treatment, namely orthodontic treatment, can cause periodontal disease. In the last 20 years, there has been an increasing number of 1,000 patients undergoing orthodontic treatment for aesthetic improvement. In the use of fixed orthodontic appliance, plaque retention tends to increase, so the gingival inflammation tends to occur during the use of fixed orthodontic treatments. And knowledge of students from the Faculty of Medicine and Health Science, University of Muhammadiyah Yogyakarta or FKIKUMY on periodontal disease has never been studied. So by conducting this study, of course, preventing research of periodontal disease during orthodontic treatment can be carried out, and because among FKIK students, many of them carry out orthodontic treatment. And this study aims to assess the knowledge of undergraduate students of FKIK UMY regarding periodontal disease during orthodontic treatment. This study answers the following question. The first is general perception of medical students about periodontal disease during orthodontic treatment. And the second is, what is their attitude towards the prevention of periodontal disease? Next, the theoretical framework. So the gingiva has a function as a support for teeth, bone protection, and alveolar, and also periodontal ligament, as well as protection from attrition bacteria, trauma, and several stimulation. And the normal gingiva has a pink color because it is affected by blood and tissue pigmentation. Peripheral gingiva is smooth and has an orange peel texture on the face, but is rarely found in infants and the elderly. The shape itself depends on the condition and the size of interdental and also the size of the tooth. It has the consistency of a soft, spongy edge and is springy and anchored to hard tissue, usually having a sulcus from 1 until 2 millimeter. The use of orthodontic appliances can cause plaque because most of them are fixed orthodontic appliances that cannot be removed and cleaned by the patient by himself. Plaque itself is a layer formed by food debris and bacteria that can grow and stick the tooth surface, and is it not removed? It is according to mention in LA 1993. And bacteria in this plaque are able to enter the gingiva and cause inflammatory response. And therefore, periodontal treatment is needed, which is divided into three, namely pre-orthodontic, orthodontic, and post-orthodontic phase. Orthodontic phase. And next is research method. The research is quantitative. That is, the research was conducted by assessing the knowledge of periodontal disease during orthodontic treatment of undergraduate student of FKIK UNY. The research data was obtained through the result of filling out the questionnaire, which were distributed to undergraduate students of FKIK UNY by Google. The participants in this study were 32 undergraduate students of FKIK UNY. The study began with the consent of the participant, and after the participant agree, they will fill out the questionnaire that had been given and answer all questions regarding periodontal disease during orthodontic treatment. After the data is obtained, it will be collected and analyzed to calculate the percentage of students' knowledge related to periodontal disease in orthodontic treatment. The result from the first question. The question is periodontitis is an infection of the gums that damage the teeth, soft tissue, and the bone that support the teeth. The result of question on the definition of periodontal or periodontitis shown that 53% said strongly agree, 43.8% agree, and only 3.1% said disagree. Next, the question of the treatment is a factor of plaque retention. The third question shown that 21.9% strongly agree, 53% agree, and 15.6% disagree or hesitant. And next result is the question is only by performing scaling, periodontal disease can caused by orthodontic treatment can be cured. The result of the third statement about scaling shown that 34.4% of respondents were in doubt, 31.3% of respondents disagree, 25% agree, and only 9.4% of respondents said strongly disagree. They said strongly agree. Next, the question: orthodontic appliance pressure can cause inflammation. The results show that the highest gain was 56.3% agree, 25% agree, 25% still hesitant, and 12.55% who answer strongly agree. And the last, the question: if you develop periodontal disease during orthodontic treatment, you should see a dentist immediately. In the last statement about going to dentist, if experience periodontal disease during orthodontic treatment, 62% of respondents say strongly agree, 34.4% agree, and only 3.1% strongly disagree. And in this study, showing good knowledge of periodontal disease during orthodontic treatment and excellent knowledge of the definition of periodontal disease. Orthodontic treatment is also recognized as a factor of plaque retention as well as inflammation. The respondent also understand where they should get the treatment when experience periodontal disease during orthodontic treatment. But there are still many respondents who think that only by scaling periodontal disease that occur during orthodontic treatment can be cured. And for similar research has never done, but uh, there is research from Iran shown that the same things regarding the level of knowledge of periodontal disease. But in Iran, it is found that knowledge of causes of periodontal disease is low. And in this study, it was found that the level of knowledge of periodontal disease was very good. And conclusion, the quantitative study in this study provides useful information regarding the knowledge of periodontal disease during orthodontic treatment in FKIKWMI students. The findings in the study indicate that the need for education about dental and oral health to increase the knowledge of FKIKWMI students about periodontal disease, mainly to achieve the more detailed understanding of the students on the treatment that needs to be done for periodontal disease during orthodontic treatment. So dental and oral health for FKIKWMI student can be improved. And thank you. That's all of my presentation today. Wassalamualaikum warahmatullahi wabarakatuh.